All right, so non-surgical blephs. So this is an interesting topic. So why would we want a non-surgical bleph? Well, we typically like blephs because this is one of the first areas that starts to actually build up with a little bit of skin. Women will typically complain it gets harder and harder to put makeup on. A blepharoplasty in itself is us just removing the skin. That's called a skin pinch bleph, and it actually works out really well and makes a really nice change. Now, how can we mirror that with a non-surgical bleph? So this is where things get a little bit tricky. Kind of depends on what we're trying to do. We do have things where we can put lasers on there, and it makes a little bit of a difference, and it can nicely tighten up the skin a little bit. We can do things where we can add fillers underneath the eyes for lower blephs. Again, lasers, we can utilize retinols to help actually improve the skin tones. All these things actually help to make a nice difference. Now, that is, I think, important to discuss that a upper lid bleph is one of the easier plastic surgery procedures we perform. It's one of the easier recoveries we perform, and it's one of the lowest risk surgeries that we do. So it's kind of one of those things of what do we need a non-surgical option for, because the surgery is actually so quick, the recovery is relatively fast, and the downtime is minimal, and the risks are minimal, that I don't know if a non-surgical option really has a lot of benefit here.